My name is John Wain, and I'm the Chief of the Division of Thoracic Surgery here at St. Elizabeth's Medical Center. I did my residency, my internship and residency at Mass General Hospital. I did a period of time doing research at the City of Hope Medical Center in Duarte, California, looking at the molecular biology of lung cancer. I then came back to do my cardiothoracic training at Mass General Hospital. That also included time at Toronto General Hospital in Canada, sort of at the very beginning of the process of lung transplantation. So I had the opportunity to be involved with the initial double lung transplant that was performed in the world. My training is in general thoracic surgery and cardiac surgery, but I made the decision after my training to pursue general thoracic surgery more or less to the exclusion of cardiac or heart surgery, so that I can operate on the larynx, the voice box, the windpipe, the lungs, the esophagus, other parts of the middle portion of the chest called the mediastinum, the upper portion of the stomach for patients with hiatal hernias, for instance, or other abnormalities in the upper area of the stomach, even to the point of sometimes using portions of the intestine, the lower intestinal tract, the large intestine or the small intestine to reconstruct the esophagus. I have a particular interest in minimally invasive surgery, that is minimally invasive resections of the lung or other structures in the chest, and that's a field that I've been pursuing for over 20 years. One memorable patient I can think of was a young woman in her early 30s who developed lung cancer. She had actually some involvement of lymph nodes, which is a circumstance which is usually treated with radiation and chemotherapy, and she had that treatment in another large city in the Northeast where they play baseball against Boston and had that treatment, and then her disease recurred. And when her disease recurred, she was felt not to have any options for further treatment other than essentially just palliative care. And my training was such that we had some very unique surgical procedures that we could offer her that allowed the possibility of completely removing her recurrent lung cancer. And so I was able to do that, and she got through that surgery without any difficulties, and 4 years later was still free of cancer, and then decided to start a family. And actually now when she comes to my office 3 or 4 years after that, brings her little daughter along with her husband, and it's been very wonderful to see her go from a situation with no hope to one where there's all the hope in the world.